Good evening, everyone, and welcome. Thank you for joining us for the IDF Forum, Managing Stress and Anxiety During the Holiday Season. My name is Emma Mertens, and I'm the Program Manager of Community Relations here at IDF. On behalf of Immunodeficiency Foundation, welcome. Whether this is the first time you have attended an IDF Forum or you have joined us before, we are honored to have you here with us tonight. Before we begin, a quick disclaimer that the information presented during this forum is not medical advice, nor is it intended to be a substitute for medical advice, diagnosis, or treatment. Always seek the advice of a physician or other qualified health provider with questions concerning a medical condition. IDF's mission is improving the diagnosis, treatment, and quality of life of people affected by primary immunodeficiency through fostering a community empowered by advocacy, education, and research. This means we are committed to serving you and providing you with the tools and resources needed to be your own best advocate and a champion for the PI community. It is by offering these tools and resources that IDF can fulfill its vision of seeking to ensure that everyone in the US affected by PI has a fully informed understanding of the PI diagnosis that affects them, all available treatment options, the expected standard of care, and all of their opportunities for connection and support within the PI community. IDF forums are made possible by our wonderful sponsors. It is due to their partnerships and contributions that IDF is able to provide programs such as this one and services to everyone in the PI community. Thank you so much to our 2021 sponsors: CSL Behring, Grifols, Takeda, Horizon Therapeutics, Octapharma, Acredo, ADMA Biologics, Bioproducts Laboratory, Farming Healthcare, X4 Pharmaceuticals, Kedrion Biopharma, and Soleo Health. IDF Get Connected groups provide an opportunity for individuals in the PI community to meet virtually in a small group setting. They are held nationwide throughout the year and are a great way to meet others. Walk for PI season is upon us. Registration is free and can be completed at www.walkforpi.org. Walk for PI is a season-long initiative of IDF dedicated to making a difference for everyone in the community. Please join us as we raise funds, walk with friends and family, and achieve fundraising rewards. For example, everyone who raises $25 will receive an IDF Walk for PI t-shirt. Questions? Email walk@primaryimmune.org. Now at this time, I would like to introduce and welcome our presenter, Ms. Jodi Taub. Ms. Taub is a licensed clinical social worker and has a private practice in New York. Please join me in welcoming Ms. Jodi Taub as she presents on managing stress and anxiety during the holiday season.
Great. Thanks, Emma, for introducing me, and thank you so much, IDF, for having me here today. I'm really looking forward to this presentation today because I think we all need it. And the holidays are coming up, and I know many of us are looking forward to having some opportunities to spend the holidays with our loved ones. So about me, I think the most important thing I'm going to start off with today is that I'm not only a psychotherapist and a chronic illness expert, but I have PI. So, and I think that's really important for everyone to know that I'm going through this with you, and I get it, and I understand it, and I live it. And that's why I'm here. I'm here to help all of us to try to make this journey a little bit better. So the holiday season can be really stressful without it being COVID during normal times, but adding the second year with COVID-19 adds an extra layer of complications for individuals and loved ones living with primary immunodeficiency diseases. Today in this presentation, I'm going to explore helpful ways to cope with the upcoming holidays, as well as ways to provide mental health tools to use year-round. So in this session today, we're going to talk about tips for the holiday season, how to take it on, mental health and PI, and some added resources. Holiday season challenges this year. So last year, most people were staying home with us. So everybody was in this together, and we were all sort of commiserating with everybody that we knew. And there were tips about how everyone else was staying home. But this year is a little bit different. This year, more loved ones are vaccinated and they plan to spend the holidays together. And we want to do that too. And we should be able to do that. We want to be included. Potential challenges this year to holiday planning may be asking immune competent family members, friends, and loved ones to adjust their own behaviors to spend time with us. Anxiety about shifting virus response, the uncertain course, and personal protection. My goodness, has it been a crazy almost 2 years. 1 month, everything's going well. The next month, we have the Delta variant. There's always something shifting. And depending on where you are living in the United States, the virus shifts too. And so we've had this ongoing experience where we've had to gauge how safe we can be. And that makes it really hard and stressful to make decisions. And so it's not uncommon for all of us to face loneliness and some complex trauma responses to last year and prior holiday seasons. The reason for this is that last year was hard and we missed seeing our friends and family members, and we want to spend the holidays with everybody. And I know that within our community, there is some anxiety this year about how do we do that? Because we want to see everybody and we want to spend time together, but how do we find a way to make it safe when seamlessly people around us aren't worrying in the way that we might have to or having to take those precautions? So let's talk about tips for how to take it on. First, I'm going to talk about risk assessment. So choosing safe ways to spend the holidays together, prioritizing our mental health, communicating your needs, being strategic, and asking for support. The first part that I think is most important in thinking about the holidays this year is to think about it in advance so that we don't stumble upon a circumstance that we don't feel comfortable with or it feels like a conflict. If we prepare in advance, we'll have a better way of coping with it, and that will decrease anxiety and depression. Every time we're making decisions this year, it's a risk assessment. Can I go in here? Do I need to wear a mask? Is this person vaccinated? Is this person safe? It's exhausting. And I know all of us have been doing this in so many different ways. And many of us have had different ways in which we all feel comfortable doing that. And so I think when you're making a choice in how to spend the holidays in a safe way, I think a couple of things to keep in mind. One is that every single one of us has different ways in which that we cope. And we also are in different places with our health. So to start off with saying to yourself, talk to your doctor. What are some safe ways that you think, your trusted physician will say to you, you know what, I think this is okay. I think that these things might be safe. It's a helpful way to objectify making decisions versus putting all the pressure on you and making it feel like it's your responsibility. It's also a good way to talk to others, to say, you know what, I made this decision with my doctor and this sounds like the right thing to do. Last year, we were prioritizing our physical health and our safety was number one. And we didn't have as many options in terms of how to spend time with people because people weren't vaccinated and our numbers were low and really there were a lot of risks at hand. But this year is different. And we've been doing this for a really long time. And a couple weeks ago, I think it was about a month ago, Kathleen Sullivan led a presentation about where we were with the global pandemic from a physical standpoint. Wait, let's go back to the other one. we skipped ahead. And one of the things that she talked about that I really wanted to add to was the importance of mental health and how we start layering back in. All of us have been affected by mental health, and we need to figure out a way to balance our mental health risks versus our physical health risks. All of us take risks when we have to go to see a physician, to get our infusions. There's a lot of medical health risks that we often take because we have to. But I think what we don't think about is the importance of taking those mental health risks. And sometimes those risks are just important. And there's ways in which to do that so that you can safely see some of the people that you love, or safely attend an event or attend a meal in the way that you like. Communicate your needs. Talk to your loved ones about how they can celebrate with you. So instead of making assumptions, or our friends or loved ones or family members making assumptions about what we can do and what we can't do, sit down and have a conversation. Say, this is what I might feel comfortable with and what I might not feel comfortable with. Be strategic. Learn how and with whom to reconnect. I know that the past year has been really difficult, and it's put a strain on a lot of different relationships. And there's been family members who've been supportive of us, and there's been some that we may have disconnected from. Lean into who those people are that will protect you and will make you feel comfortable, so that you don't have to feel that there's added anxiety to making choices for the holidays. And ask for support. Lean into those family members and friends who are going to be supportive. So holiday event prep. So this is divided between our pregame, how to talk to friends and family members about COVID-19 safety protocols, pace yourself, and how to have an exit strategy. And some of these can be used on non-COVID times as well, because the holidays are always a stressful time for everybody. They're enjoyable, but there's a lot of planning and a lot of things that can go on. So in terms of pre-gaming, make decisions and set expectations for yourself and loved ones prior to the holidays. One way to do this is to first start off with yourself. Think about, okay, what is it that I'm afraid of? What are some things that might be concerning to me? And what are the things that are really important that I really want to do? Is it really important this year that I really want to spend time and see my grandparents, or spend time, and have a traditional Thanksgiving? What are your fears about that? There may be a child there who, is not vaccinated, although hopefully now with the new vaccinations, more and more kids can be vaccinated, or there may be a family member who isn't vaccinated. And that might be uncomfortable to you. It might be somebody who's an acquaintance. And so to kind of sit down with yourself and write it out. Talk it out with a trusted resource. Talk it out with somebody and weigh out those options. What might be important to me, and what might this look like? Establish negotiable versus non-negotiable safety options. I think this is really important, so that you're not in a situation where you show up to an event and all of a sudden you're really uncomfortable because something happened where you felt unsafe and then you felt like you couldn't make a change. How to talk to friends and family members about COVID-19 safety protocols. I know that this has been hard for everybody to do. None of us want to have to tell other people how to engage or how to make modifications to hang out with us. It's been a burden, and it's been a burnout, and it's hard. One way that I have recommended doing is to send an email out. This way, you're putting it in writing. It gives you something to reference for your friends, for your family members, and for yourself. And it also allows you to not continuously have this conversation, which can be re-traumatizing. I think it's important to also remind others about what you can do. There's a lot of things that we can do. And for people to just assume that, oh, we just can't show up, that's not right. And sometimes you have to tell people, wait a second, like there's a lot of things that I might feel comfortable with if you can be creative with some of the modifications. And be creative with the modifications. Maybe there's a meal that you find out, there might be too many people at this meal and I'm not entirely comfortable about that. But maybe what you decide to do is that say, I'm going to show up afterwards and, come to spend time with people. Or if you're not comfortable eating inside, meet somebody, say, hey, do you mind, meeting us outside? Maybe you do a game night and you do an alternative, or you do a Friendsgiving, so that there's other ways in which you can still participate. And pace yourself. Pick a holiday, a portion of a holiday, or create a new holiday tradition. Some of the holidays may be a bit more challenging due to weather on the East Coast or in the Midwest if it's cold and it doesn't give us the option to be outside. There might be challenges with your own health and you're not willing to take some risks. And there might be certain holidays that feel more comfortable than others. Going to a big New Year's party with a bunch of people who are unmasked might not be the year to do that. But that doesn't mean that there's ways in which that you can't get together with people that you love, and sit down and find some creative ways to do that. Have an exit strategy. I'm sure many people on this call have been in positions where they've gone somewhere and they didn't anticipate that there was a person who showed up or a situation that occurred, and all of a sudden the scenario changed, you didn't feel as uncomfortable, such as an unknown guest arriving, someone revealing recent risky or uncomfortable behaviors or exposure, feeling overwhelmed or anxious. And all of these things can happen. So a couple things. If you are in a situation where you are uncomfortable, try to think about what you can do. And some people will wind up in situations where they might go into fight, flight, or freeze. And I'll get into that trauma response and later on today and how to deal with that. Talk yourself down. Remind yourself that you're going to be okay. Take a moment, take a step outside. You might need to go to the bathroom for a moment, or step outside and make a phone call to a trusted person or text somebody so that you have some time to calm down and make a rational decision. Preparation helps decrease stressors and sets you up for success. So try to think about all of these options in advance so that you're prepared. Mental health and PI. COVID-19 contributing factors to stress. These are some of the things I'm going to talk about today. So how has COVID-19 contributed to stress, anxiety, and depression? The stress response. So I'll talk a little bit about fight, flight, or freeze. Signs and symptoms of anxiety and depression. Talk about some coping skills. How to gain the right social and emotional support. Mental health coping tools, and when to seek professional help. COVID-19 contributing factors to stress, anxiety, and depression. So I'm going to go through the list of some of the things, and then I'll talk a little bit about all of them in a little bit more detail. Relationship burdens, discrimination and judgment from others. COVID-19 immune disruption impacts brain neurodevelopment, increasing clinical anxiety and depression symptoms. Changes in the way we attend work and school. Isolation, so physical and emotional isolation. Ambiguity about our path forward. What does this look like for us? When are we going to be protected too? Concerns about obtaining safe medical care. Complex trauma from living with a rare chronic illness. And then I'm going to talk about a recent research article which talked about some of the psychiatric risk factors for patients living with primary immunodeficiency disease during the global pandemic, which was done by a researcher who is also a PI individual herself. So let's go back. I tend to be wordy, but hopefully it's worth it. Relationship burdens. This year has been really tough for a lot of people. And I know that as a community and as a PI community, we've had to take more precautions than other people, and we've been at risk. And I know that that's been really hard. There's also been a component this year that the things that keep us safe, such as wearing masks or getting vaccinated, became political and personal, and depending on people's different value systems, where you were living in the country. And I know that put a lot of burden and strains on all of us this year. Discrimination and judgment from others. Many of us have lived in the world for a very long time and have been able to interact and go about our days. And even though we, deal with our health issues, we don't have to have every interaction be around keeping ourselves safe. I've said, I think a couple times this year, I don't know how many times I've started conversations. I'm immunocompromised, but can you put your mask on, please? Can you give me some distance? I would never have had these conversations before, and people wouldn't have even known what that meant. So there's been a different way in which all of us have had to interact in society in a way that we haven't before, and that's been really stressful. There have been some really great studies that came out this year, but they also mimic studies from the past that I think actually will be very helpful for our community. COVID-19, they've shown in studies that the immune disruption impacts brain neurodevelopment, increasing clinical anxiety and depression symptoms. This is something we've known for a while. And in fact, I had the opportunity, I think it was about 6 or 7 years ago, in conjunction with the IDF and the mood disorder clinic at Harvard, that showed that we had higher rates, we meaning patients who have primary immunodeficiency had higher rates of anxiety and depression than the rest of the population. And some of that was related to gray brain matter. And we're learning more and more that there is a physical connection between inflammation and infections and viruses, and that leaving others with experiencing psychiatric symptoms. And I think it's important for our community to realize that we're at risk, and we're at risk, one, but number two, it's not our fault all the time. It doesn't mean that you can't cope, but also it's important to recognize that, so that if we are at risk for clinical anxiety and depression and post-traumatic stress symptoms, that we can get psychiatric help and treat it. Changes in the way that we attend school and work. It's been higher risk environment for many of us. Isolation, the physical and emotional isolation, I know has been so hard for our community. And I'm so glad that everybody joined us tonight, because I think it's really important. Ambiguity about our path forward. We still don't know entirely how we're going to be protected and what that looks like. We just were told that we needed to get a third shot. Now I'm hearing we're needing to get a fourth shot. And we're still being told as a community that we need to take precautions, and we're not sure what that looks like. And for our vaccinated loved ones around us who feel confident that they'll survive COVID and it may be mild, that's not the case for us. And this can make it really hard. Concerns about obtaining safe medical care. If you live in a state when there's an outbreak and the hospitals are overwhelmed, worrying about getting sick from COVID because you're getting your regular treatment and care. Complex trauma from living with a chronic rare illness. Living with a serious chronic healthcare condition, such as primary immunodeficiency and all of the other diseases that often come with having PI, is complex trauma, meaning that the trauma comes from within. It's our bodies that create this experience. And that's why often when we get sick or we have a flare, many of us will feel that, oh no, here we go. And it reminds you of other days past, because you know what that feels like. And so this year, many of us have experienced trauma symptoms because we've had a lot of fear around COVID and ways in which that we need to cope with that so that we can continue to move forward. I talked a little bit and had mentioned before, there was a recent research article. There's been many articles that have showed that, living with primary immunodeficiency during the COVID pandemic caused increased psychiatric risk factors. And this should not be a surprise to anybody here. So, stress response, fight, flight, or freeze. So this is where I'm going to get scientific with everybody. And I think it's important. I like to stay on top of science and help people to understand this. So bear with me a little bit if you're not a science person, but I want to explain what happens when you're having a stress response. So fear and trauma can trigger a stress response. Common stress responses can be fight, flight, or freeze. So physiological steps. So a stress response starts in the amygdala, which is in our brain. It's considered our old brain, and that's what guides emotion and memory. And it sends signals to the hypothalamus. The hypothalamus then sends a message to our central nervous system and the endocrine system, and then the autonomic nervous system, which releases stress hormones such as cortisol and adrenaline. And that's what most of us will know is that fight or flight feeling, where we may get upset. We might, something takes us by surprise and you might feel butterflies in your chest, or you feel nervous or uncomfortable and anxious. And that's led by our sympathetic nervous system. Our parasympathetic nervous system freezes. It shuts things down. And these are two things that can happen. And so what I want everyone to be aware of is why this happens, so that if you're in a situation during the holidays where you do feel uncomfortable, you understand what that is about. And then I'll talk a little bit about how to cope with that. So signs and symptoms of anxiety and depression, and I'll just go through them quickly. Depression, so signs can be acting out, such as anger, rage, irritability, low tolerance for daily stressors, negative thinking. Turning in is decreased interest in school, work, or social activities. Poor hygiene, boredom, increased isolation from peers, decreased self-esteem, increased guilt and shame. Tearfulness, intense feelings of sadness and emptiness, hopelessness, Perseveration of thoughts. That means, many people now use the term I spiral. So it's a spiral of thoughts, ruminating thoughts that you can't stop. Pit-like feeling in your chest or stomach, and difficulty making decisions or increased fatigue. Anxiety symptoms are ruminating about future events which are out of your control. Constant and intermittent worry with or without distractions. Restlessness. Ambivalent thoughts, so having a hard time making decisions and concentrating. Obsessions and compulsions, such as counting, checking, and hoarding. Disruptions to sleep patterns, waking up early or restless sleep. Having a rapid, so physical symptoms might be a rapid heartbeat, difficulty catching your breath, uncomfortable energy, panic attacks in the presence of emotional stress, or PTSD. Now, for the physical symptom part, I want to also caveat this, is that also means in the context of emotional stress. So you could have those physical symptoms by dealing with asthma or dealing with a sinus infection. So this is not in the absence of feeling like you're having a hard time. And there have been recent studies that have shown that people living with PI face higher rates of anxiety and depression. So it's important that we're aware of this. So let's talk about how to cope with this. So I brought up the fact that we might have a tough time. How do we deal with this? So I narrowed it down to 4 different things to think about. One is getting physical activity and enjoyable distractions. When you're feeling depressed or anxious, or you're feeling fight or flight, one of the best things that you can do is to get physical exercise. And there have been many studies over the years that have showed that this is helpful, but there were studies that came out during the pandemic because so many people were going through trauma that showed that getting physical activity was helpful, because what it does, it moves your brain into a different portion of your brain, and it causes you to stimulate and focus on other things, which then causes a calming response, which calms down the cortisol fight or flight response. So get moving, do some exercise, go for a walk, household tasks, joyful distractions, watch TV, listen to a podcast, craft, create, do something that you like, explore talents and interests. It's important to lead a balanced life, and keeping a routine of work and school, recreational and leisure time. Having a balanced life can help you to feel that you're living a valuable life with purpose. That's one of the reasons people had such a hard time with COVID, is because our lives have become so small, and those little things make a difference. Talking down the negative thought spiral. So one of the things that happens is when you do get a fight or flight response, or you're anxious, you're upset, it's easy to start ruminating and thinking about how you're worrying about events or worrying about different things. Work through irrational versus irrational thoughts. Actively fight off your thoughts. Ask yourself in your mind, is this rational? Is this something that's realistic? Is this real? And talk it down. Counter negative thinking with an opposite idea. So if there's something like, so for example, you say to yourself, the pandemic is never going to end. An opposite idea will be like, that's not true. We have vaccinations. People, the rates have come down. Now children are getting vaccinated. There now are treatments that are coming out. So it's talking back all of the negative thinking, and continue to do that without indulging it. So instead of allowing yourself to think through those thoughts, even if the thoughts still are there, that doesn't mean they're going to go away, but try to fight them off. Social and emotional support. Stay connected to friends and family. When you're feeling depressed and when you're feeling disconnected from others, it's hard to stay connected, but it's important that you do. Make modifications so that you can attend events. We have to start integrating and spending time with people again in a safe way. And for all of us, we have different levels of safety and comfortability and different things that we're dealing with. You might have a child that's not vaccinated. You might have a situation that you don't feel comfortable with, but we have to try to find a way to connect to our community, because being with, and also connecting with us, connecting with our PI community, because it decreases isolation and enhances connection and understanding. Lastly, professional mental health. Utilizing some mental health resources that I'm going to provide for you, and participating in professional mental health when you need it. Social and emotional support, how to connect and get the right relationship support. Acknowledge that our friends and family members and loved ones may not understand how you need to be supportive. It's really important that you tell people what you need. Most of us give support in the way that we think other people would want support. But the truth is, it's different for everybody. Some people are really good at giving emotional support and talking on the phone or venting. And some people like to be logistical and practical. But I think you have to tell your friends what you need. Initiate conversations around how to integrate modifications for the holidays. Talk to your loved ones about what this might look like for you. Be compassionate and recognize that everyone has been impacted by COVID-19. I know it's hard to think about that, but our entire world went through trauma over the last year and 9 months. And I think it's easy for us when we're feeling vulnerable to think that the other person is responding to us, that maybe they're feeling distant from us. Sometimes we forget that everybody's going through this, and to be mindful that it's not always personal, that people who aren't at high risk in the way that we are still went through a really difficult time. Focus on individual strengths and lean into support of others. Focus on the things that you know that your loved ones are able to do. If somebody is comfortable doing something, ask them to do it. That's the best way to get support. There was a 2020 study that came out about social support and stress and life satisfaction among adults living with rare disease. And the number one support that people wanted, that they found in this research, was that we wanted companionship. Companionship support was the most important for satisfaction with life. And I think that's probably what made it so hard for all of us this year, was the isolation. So continue to try to find ways to connect with your loved ones. And I think the holidays are a good way to start. So mental health coping tools. If you listen to my lecture in February of 2021, and I talked about managing stress and isolation during the pandemic, I mentioned some of these resources, and I'm bringing them back again for those of you who may not have listened to that discussion, but also as a reminder. So mindfulness and meditation resources, mood trackers and journals, mental health resources, and professional mental health. Mindfulness and meditation resources. There are some really great apps that can be used, such as Smiling Mind. It's a free resource for youth. So this one is good for children, and it's age targeted, and it's meditation created by educators and psychologists. Insight Timer is a guided meditation, so it allows you to set your own meditation times. Headspace, many people have heard about. It's quite popular. It's free and gives you 10-minute meditations daily. I listed some mindfulness and meditation resources. Some people like to read, and I always say, choose your mental health poison. Nobody needs to do one thing. If you don't like meditating and you don't like apps, you might like a mood tracker. So choose what works for you. And I listed a couple books that I think are really helpful. MBSR Every Day, which is mindfulness-based stress reduction. We know that that's been very helpful for coping with chronic healthcare conditions. Daily Practices from the Heart and Mindfulness-based stress reduction by Alicia Goldstein and Bob Stahl. John Kabat-Zinn, who is the creator and founder of Mindfulness, Full Catastrophic Living, How to Cope with Stress, Pain, and Illness Using Mindfulness Meditation. That was his original book. That was helping people. That was his inspiration, was to help individuals who were coping with chronic healthcare conditions. And then also mindfulness-based stress reduction, the MBSR program for enhancing health and vitality. Mood trackers. I love mood trackers. If you guys have not used a mood tracker, I highly recommend using it. It's kind of a modern day way to journal. They're really helpful to track patterns in mood, behavior, and feelings, and to decrease negative thought patterns and examine automatic thoughts and identify triggers. Often we don't realize when little things are building up, and it's more when something catastrophic happens. We're like, oh, wait, I'm upset about this. But sometimes a series of small stressors can lead to our mood being off. And if you know that your mood is off and that you're irritated or you're agitated, it allows you to kind of reconnect and take a step back. It may be, you might say, hey, you know what, I've been in a bad mood all week. This might not be a good time to initiate a difficult discussion with somebody. And I need to take a breather and take a break. And I might need to add in some more self-care to help. There's several Dailyo mood tracker, mood kit, mood tools, and mood mission, and they're all great. I have a list of mental health resources, and you certainly can take a look on the presentation. And it's just a list of associations and institutes that can be helpful, suicide awareness hotlines, journals and magazines for mental health and rare disease organizations. Lastly, when to seek professional help. When it impacts your daily function, when there's an inability to attend to daily responsibility and self-care, if there's an emergency and you're experiencing suicidal thoughts, injury to thinking about injuring yourself or others. And side note from me, I believe that everyone and anyone living with a primary immunodeficiency would benefit from psychotherapy. It can only help. We spend a lot of time managing our physical health, but our mental health is just important, just as important. And just like I talked about today, we're at high risk for psychiatric conditions, and living with primary immunodeficiencies has been stressful, and it's beneficial to find a way to talk to somebody and figure out a way to cope. Practical tools and coping skills do not replace professional mental health services. And I think this is important. I added a lot of these coping skills and practical tools, and they're really helpful. But if you're dealing with clinical anxiety and depression, that doesn't replace mental health services, and that's something that you should investigate. Professional mental health options. So there's lots of options. Talk therapy, which is traditional meeting with a therapist. I'm going to list some different types of talk therapy as it's become more specific over the last couple of years, but more specifically, we found in research that ACT, CBT, MBCT, and MBSR therapists who utilize these modalities, that they've been helpful for chronic healthcare conditions. So ACT is acceptance and commitment therapy, CBT is cognitive behavioral therapy, MBCT is mindfulness-based cognitive therapy, and MBSR, mindfulness-based stress reduction. Most therapists who are in this sort of category and doing this work, you know, are familiar with these modalities, and that should be helpful. Somatic therapy, so body-centered therapy. There are some therapies that a lot of people who have been dealing with trauma and post-traumatic stress have felt comfortable and have really helped with dealing with trauma. And it's related to not just the talk component, but doing different modalities that involve the body itself. Psychiatric assessment for psychotropic medication. If you do and you are experiencing clinical anxiety and depression or other psychiatric conditions that do require medication, it's important to get a psychiatric assessment. And number 4, genetic testing for psychotropic medications. I always recommend this for PI folks. I'm a practicing psychotherapist, and I have all of my patients who are on psychotropic medication do either Genocyte and Genomind. What they are is it's genomic testing. It actually is a simple kit that can be sent to your home. It has to be done in the context of a psychiatric provider. But what's really nice is it gives you your profile of what psychotropic medications are right for you. Everybody has a different profile and different reasons, and it gives you a better opportunity to not have side effects and to be on the right medication and the right dose. So in closing, if your mental health is better managed, this will allow for flexibility and better decision-making for your physical health. Gaining support and understanding and finding safe ways to connect with friends and family members lends to leaving, it should not be leaving, it should be leading, my spelling mistake, a fulfilling and meaningful and purposeful life. Thank you so much for having me here today.
Wonderful. Thank you so much, Jodi, for your awesome presentation. Now at this time, I would like to introduce my colleague, Colleen Brock, Manager of Medical Programs, and she will be moderating our Q&A session this evening. Take it away, Colleen.
Hello, everybody. Jodi, thank you for an awesome job. That was fantastic. I want to start out by saying to everybody, I have received a lot of COVID-related questions. And instead of answering those, I'm going to preface it kind of along the lines of what Jodi said earlier. Everyone's health journey is different. In my case, if most of you probably know me, I have CVID, as do two of our children. So we've been doing this for 26 years, and you have that risk benefit balance all the time. And this just kind of took it to a new level. So even though there are a lot of questions, every single question is different. And that's because every single person is in a different place. And so there's not going to be one size fits all for, I'm back. So there's not one size fits all answer for all the questions. And that's something that you have to, like Jodi mentioned, look at for your own safety, your own mental well-being. I also encourage you to talk to your physician about your concerns and have them help you walk it through if you can't. I know in our situation, we're going home for Christmas to my parents. My brother's family is not vaccinated. We are all vaccinated. And so there's already been discussion about, okay, what are we going to do? And we will come to a consensus of opinion as to how we're going to handle it. And it will most likely be when they are present, we'll wear a mask because we're going to be in one room. And when they're not there, we're all fine. So it's just kind of one of those things where you have to talk to your doctor, think about that risk benefit ratio, and go forward. So having said that, if you have concerns, reach out to Ask IDF. We'll be glad to help you with the science background of what we know now. We're going to have another COVID forum in December with even more information about things that are new and coming out in studies. So stay tuned for that. But Jodi, there's some questions here that touch on no matter whether we had COVID or not. And I'm curious as to how you can help people. So one of them is handling fatigue and brain fog during the holidays.
That's a great question. I mean, I think many of us experience fatigue and brain fog, and I'm probably experiencing it right now. So I think it's pacing yourself. So trying not to overpack, overrun, give yourself time to take a break and make sure that you're continuing to do self-care. So making sure that you're able to get a good night's sleep, not overcommit yourself, leave early if you need to, so that you're in the right space that you can enjoy it.
I have a question from somebody who, and again, for whatever the reasons may be, has been isolated since March of 2020, which is a very long time, and apparently is now facing another Thanksgiving and Christmas alone. What do they do?
So I understand where you're coming from, and I know that this is so hard. I'm actually doing my first holiday for Thanksgiving since then too, and I think I'm gonna say two pieces to this, and one part does go along with what Colleen was saying. I think you should first and foremost talk to your doctor. Your doctor knows your body, your risks, what you can do, and if your doctor is saying to you, "Hey, I think that you really can't go anywhere and it's really safe for you," then that's one situation. But if your doctor says, "You know what, I think that there are some potential risks that you can do. There's some modifications that you can do. There's some options, such as asking family members to get tested if possible, or wearing a mask, or choosing not to eat during a meal." But I think that there's ways around it. And if you absolutely can't go and you can't participate, I know everybody hates Zooming, and trust me, I hate it too. So we'd much rather be there in person. I happen to be Jewish, and for the holidays this year, it fell during Delta, and most of the synagogues, didn't have the holidays, and I Zoomed the whole thing from my backyard. And it's really hard. But at the same point too, if you really can't go and your doctor says that you can't, and you feel too anxious or too uncomfortable to go, then I encourage you to choose to ask a family member to do a Zoom. It makes a difference to feel like you're a part of that.
Another question that I have is I usually have anxiety after an event, questioning what should I have done differently. Any advice for preparation prior to the event to stop me from doing this?
Okay. Well, I'm glad you listened to my presentation today because it was all about that. I recommend going through again if you can, and when IDF, puts the slides up, I did a walkthrough on that. My guess, and I don't know the personal situation that you're in, but my guess is that you're having anxiety after the event because there's probably some things going on, whether it's relationship issues with some of the people there, uncomfortability during those events that is causing you to feel that way. And so I think it's dealing with some of those issues before you go so that you're not feeling it afterwards. And if you are still feeling anxiety afterwards, again, to use some of those coping skills I talked about today is getting a distraction, particularly with anxiety, because it is a physical symptom. You really want to get out of your mind of overthinking things. So whatever that distraction is, it could be going for a walk, listening to a podcast, watching TV. What you want to do is sort of get a distraction from your mind to help yourself to calm down. And again, please review some of those things that I listed today.
Kind of along those same lines, how do I set boundaries with family members who don't understand the pandemic is over for those of us that are immunocompromised?
Oh my goodness, this is the hardest thing. and I have to say, I think that is the hardest part right now, or one of the hardest parts for a community right now, is that there's some people right now, pandemic's over, and it's not over for us. And that makes it really difficult. I think in those relationships, you can give people information, but I think more so than anything else, you can't convince other people to understand what we're going through. The way that you set the boundary is to explain to people, as I sort of talked about today, about where you are. I have found it very helpful and the patients I work with, because I work with patients who have PI and patients who have chronic healthcare conditions who are at risk, to write it out in an email. Sometimes what I do also, so that it seems less subjective and more objective, is I will use an article. I'll send a local research article or something. There was a great article, actually, Kathy Antela was in recently with NBC. And so if you Google immunocompromised COVID, and you can see there's so many different articles that are listed, I would click on some of that and give the information, because you can see that we are still supposed to take those precautions. And so I think when you're talking to them is to give them that information, because they're not looking at all of the news in the way that we are, because they're done and over with it.
Thank you, Jodi. You talked about companionship, but what do you do when you live alone and you have no companionship?
So that is also, yes. So that is also very hard. And when I was talking about companionship, it didn't mean in-person companionship. So that means anybody in your life. So it could be a friend, it could be a relative, it could be somebody in your life, it could be a coworker, it could be, anybody in your life that you spend time with or that you care about, and you may not see them in person. I was home, really, I did a true isolation. My companion this year was my visiting nurse who came twice a week. She was the best thing. she got me through the pandemic like nobody's business, and I look forward to her putting in my needle in my chest. and we became friends out of that. So it's not always about who you live with. It's about connecting with the people in your life. And so when I say companionship, that means reaching out. There are days that, and I'm going through this too, and I went through this too. I went through a period of 6 months for literally, we saw my nurses and my healthcare providers, but I made an effort on my loneliest of days to text people and to email people, even when I was feeling horrible. So when you are living alone, try to reach out and try to reach out to the people that you love, even if right now it's not safe for you to see them.
Thank you. So how do you prepare children with PI about potential changes? So let's say you've made plans, something happens, now they can't go. How do you prepare them for this may or may not happen?
Right. And sorry, Colleen, is it children with PI?
Mm-hmm.
Yes. Well, unfortunately, this becomes a rite of passage for our community. Unfortunately, part of this is learning that often we don't know when we're going to get sick, and we don't know when something's going to happen, and we may or may not be able to go to something. I think it's having a conversation about that and preparing them in advance so they're not disappointed. So setting up that option to say, you know what, here are some things we're thinking about, but we might not be able to do this. If we can't do this, here's an alternative. So think about a backup plan that you can give to your child if you're not able to do something that you're able to do in a safe way. And I also encourage you to have those conversations and talk to them about that, because it's also a good life learning lesson, because that's how life works. There's times that we want to go outside and all of a sudden it's a rainy day and we have to change plans. And also to think about it as a parent, these are really good coping skills. And as your child continues to grow, one of the benefits of having PI is that we get really good at adjusting and modifying things and learning how to make changes and learning how to deal with disappointment. And that leads to resilience. So for you as a parent, remind yourself that even though your child might be disappointed, you're teaching your child resilience.
Yes, and we'll see becomes your favorite words. It's never yes or no. We'll see.
Yeah, maybe.
Another mom sending our 9-year-old Zebra back to 3rd grade once he's received his 2nd vaccine in December. He's developed anxiety while being isolated since March of 2020. Any tips on helping him ease back into school? What can I do leading up to his return?
Yes, I'm really glad that you asked that question, because that's, so true. And even non-PI kids are having a hard time with adjusting to this and the social anxiety, and especially, at such pivotal moments. I think prior to going back to school is trying to, first of all, talk to your child about what they're anxious about. What are the parts that they're anxious about? Is it about like, who am I going to sit with at lunch? Is it about where am I, how do I get to school? Where am I going to sit? So go over and ask them, go through their day and ask them what are the things that they're nervous about. I know a lot of children this year have felt like, oh, I'm not going to have any friends. I'm not going to know anybody. I feel disconnected. So find ways in which to ask them what they're afraid of. I also would, in advance of that, get in touch with their teachers to make sure that their teachers are aware that your child is feeling anxious about that, and making sure that they're watching out and making sure that there's other children that will engage with them so that they aren't isolated. And then also in some of the things that they're concerned about or they have anxieties about, you might be able to practice some of these things at home. What is it like to go to the bathroom with a bunch of kids? What do I do when I'm, have to choose where I'm going to sit in at lunch? Can I sit with all the kids? Where do I go? So go over some of these things and start practicing and talking about it in advance. And the key word is transition. So just kind of throwing your child to the wind is what's going to set your child up for anxiety. Do it on a basis. And it may be, you can talk to you can talk to the school and talk to the school social worker and ask them and say, hey, can we start off with a trial? Like, is it possible that, maybe you let my child come in for a couple hours and see how it goes and adjust back in rather than a full day if they're not ready.
Great ideas. So going back to helping the child with PI and changing circumstances, what advice do you have when a family has an event planned, whether it's Thanksgiving, Christmas, New Year's, birthday party, whatever, and the child becomes sick or something happens and they can't go, and the child knows it's because of them and they feel that guilt, how do you ease that child and get them not to feel that guilt of, oh, we couldn't go because of you?
I think that that's a really, really hard part about all of this. Keep verbalizing and reminding your child that people get sick all the time and that adults miss out on events too, and that it's not just about you, and offer an alternative. So if that child missed out on an event, say, okay, we didn't get to go to this party or event. What's our makeup event? And let them choose something fun that they have to look forward to as an alternative, instead of, I just missed this and now I get nothing. And I also would try in some of those events, depending on what that party is. So if it's, a party with other kids, or if it's a holiday, maybe they miss out on Thanksgiving. Is it possible to ask your family if there's a favorite part of Thanksgiving, like eating pumpkin pie, and they can come over to their, grandparents, or, and be able to do that. Or if it's, Christmas, trying to find an alternative so it's not like they just miss out on everything. They can do a redo holiday.
There you go. What do you do though, if you have family members, you reach out, you've written, you've said, I need this is what makes me feel comfortable, and they just aren't buying it?
Then this is not the year to hang out with them. I think that this year has been hard enough. And when I talked about, when I listed COVID-19 stressors, one of the ones I listed was relationship stressors. There's been I know for a lot of us that it's shifted the relationships that we've had, because we can't interact in the same way. And there may be people who are just not supporting us. And if that's the case, we have enough on our plates. This might not be the time to invest in those relationships. And even though it might be a loss, I think you focus on the people who get it.
Very true. So do you have some particular phrases or wording, templates for boundaries, things that you can recommend? And again, every single situation is different. Every single person is different, and every single person's risk factors are different. And that's what makes this so completely difficult to deal with. But do you have any kind of tips and tricks that might help family members better understand, even if you go while you're anxious?
Sorry, the question? So help them better understand.
Yeah. Do you have any tips and tricks, sayings? Do you have a template that you use? Words that you use to better understand, or to make people better understand why you are wearing a mask when they're in the house because they're not vaccinated, and that makes you very uncomfortable?
100%. The first one I use, and I think that this is the most helpful because of the politicization this year, and because of how polarizing it is, and because of the way people interpret COVID and the information that they read, everybody has a lot of different opinions about safety and protocol and what they do. The best way one thing that I have found to be very helpful is to say, I follow the rules of my doctor. I follow the rules of my medical professional. My medical professional said that that I need to wear a mask outside. And in that way, it's not subjective. It's not about what you read. It's not about what you Googled. It's not that you're being overcautious or overzealous. You have a rare disease and you follow the medical opinions of your doctors. I think that that's the first place to start, and it makes it objective. If there are people who continue or they want to debate, I think then you exit that conversation and say, you know what, this is really personal for me and it's a safety issue. And I have to keep myself safe. And I think this is probably a conversation that we shouldn't have if the person is starting to become contentious. The other part of this is that there are going to be people who you're just not going to convince, and they may not understand that. And it's not your job to convince somebody else to understand science and how PI works. If they want to hear it and they're interested in it and they're asking in a really, kind way, and they want to know and they're being open, that's one thing. But if there are people who are sort of debating with you and making you feel shamed or uncomfortable or questioning what you're doing, I would end that conversation, because it's not worth having.
Jodi. Kind of outside the realm of holidays, somebody has written, she is a single woman who's been recently diagnosed with a PI, and she's questioning advice for dating.
I am so sorry that you got diagnosed with PI during COVID. So it's never a good time to get diagnosed, but I'm so sorry that it's been hard. This is a subject I talk about quite a bit. In dating, I think it's making a judgment call, and it's thinking about boundaries. There are people who are going to be open-minded to this, and there are people who aren't. And I think that when you are starting to date, I think you make the judgment call about letting someone get to know you, and get to know about you and who you are before you share that information. But I think what you have to start off with is where your own boundaries are. There are many people in the PI community who have felt very comfortable in the journey of their diagnosis, and they'll tell people on the first date. And it's one way for them to sort of like weed out who's right or wrong. And there are people who are in our community who've married people that they told on the first date. And then there's other people who didn't feel comfortable with that and waited and said, you know what, I'm not as comfortable disclosing. So I think the first part is to realize that, think about your own boundary and your own comfortability with it. Like when is a right time for me to share that? And when is a good time, for me to share that with that other person? The other part of that is to also think about steps in sharing information. So it may be that someone asks a question and they might just ask a small question, such as like, well, what is that? I think that it's important to tell people when you are dating to, you tell them what primary immunodeficiency is. Luckily this year, you have some words and language that we can actually use that people can understand. Prior to the pandemic, if you told somebody that you had antibody issues and that, you were immunocompromised, they might have looked at you with four eyes. Now you have language that you can actually use. And so I always recommend coming up with a statement that makes sense to you, in terms of explaining that. But the second part is also how it affects you, so that people don't make assumptions about what it looks like for you. So you might say, I got diagnosed with primary immunodeficiency. I receive antibody infusions, just like they've talked about convalescent plasma this year. I receive antibody infusions for the rest of the known diseases every 2 weeks. And, for the most part, I manage my illness. I get sick with, I have to be cautious around people when they're sick, and I lead a normal way of life, whatever it is. But to set some sort of expectation so that the person doesn't make assumptions. And then the last thing that I'm going to say is that, since you're new to the community, is that you can date. We date, we get married, we have kids, and we lead normal ways of life. And if somebody isn't down for, accepting this, they're not the right person for you, but there will be somebody out there who will.
That's so awesome. Thank you, Jodi.
Because Colleen, you know that too.
I do. I know that very well.
Yep.
So holidays aside, I noticed that my mental health is directly impacted by my physical health. For example, when I get sick for several days, then I feel very depressed by the third day. Any advice or tips to combat that?
Yeah, well, now you know why. So we were, that's part of the presentation I was trying to talk about today a little bit, was that one of the things that we actually are learning, and we saw that with COVID. So COVID, I believe 11% of people end up with psychiatric healthcare conditions in long COVID. And that's one of the reasons on the, if you actually see on the high risk third shot, mental health is listed. And that's because infections cause inflammation within the brain. And so it's not uncommon to have a physiological response that causes anxiety and depression. But then the second part is the complex trauma part of the experience of getting sick again. So what I do recommend are doing some of the things that, I talked about today, but if you are experiencing clinical anxiety and depression, you should talk to your doctor, and you should think about getting some professional help and potentially seeking, psychiatric assessment if it's possible that you might need medication. And I highly recommend that, because PI is hard enough to adjust. We manage our own healthcare. And if there is something clinical going on, you should get that assessed. And I think it would be important to talk to your physician, but also mental health professionals who can understand that.
And to end with that, the people who are just literally terrified to come out of their house or let a single soul into their house, words of advice to taking that first step, because unfortunately there are a significant amount who COVID has just sort of taken over their thought process, where even walking around the block is just too terrifying.
Yes.
And so recommendations for first steps.
Yes. And Colleen, what you're talking about is really real. And I know that a lot of people in our community have felt that and have experienced that. And it's scary. I think what I'm going to start off with is that I want you to hear what the IDF medical board has been telling us. And I think that that's the first part, is that we have to start, recognizing that we have to start integrating. And we were at risk for a lot of other diseases before, and COVID is another one, but we still had to engage. And it's time to start thinking about, but starting to take those steps to move forward. I think that I would start with making a list of the things that you used to do, and the things that were everyday things that you did. And it might be, going to a coffee shop. It might be going into a grocery store. It may be, walking around the block, going to a dentist for the first time, seeing a friend. So I want you to make a list of those things. Then I want you to prioritize, what do you think would be the easiest? What would be the least anxiety provoking to try? And to choose one of those things and to try first, so that you're not throwing yourself, to the wolves. So instead of going from not doing anything and then walking into a restaurant where people aren't wearing masks, do something small to get yourself to start adjusting to that. And some of those things too may also be asking for example, wearing a mask. And maybe what you do is you take a small step. So it might be that you want to go into a store. You haven't gone into a store for a first time, and you ask the person, or you go into the dry cleaner and said, hey, do you mind just, leaving the door open? And, I'm going to give you my credit card and I'm going to take a step in, just to try to start. So it's starting off small to start working through your anxiety.
I think that is an amazing way to end. There is hope. We are getting there. We will all be together again.
Yes.
This is not going to last forever, although some days it seems like it.
Yes, that's right.
So thank you so much, Jodi, for all of your help, for all of your tips, for your wonderful resources and advice. It is greatly appreciated. And with that, I'm going to turn it over to Emma.
And before we close out, we want to again thank all of our wonderful sponsors from this evening, CSL Behring, Grifols, Takeda, Octapharma, Accredo, Farming, and Kedrion Biopharma. Thank you so much all for joining us this evening and for supporting IDF in this programming. All right, so it looks like we're getting ready to close out. So thank you so much, everyone, for joining us this evening. We hope you'll join us for some of our upcoming forums. Next week, we have how to thrive and survive in an emergency situation, as well as what's special about a specialty pharmacy. So thank you so much. We hope that you found the information presented to be helpful. And please remember that IDF is here for you every step of the way on this journey. Thank you so much. Have a great rest of your evening.